Hello, my name is Brianna and I'm a fourth-year pharmacy student at Drake University. Today I will be giving an overview of the newly approved prescription medication Mounjaro. For the remainder of this presentation, I will refer to the medication by its generic name, Tirzepatide. Of note, this presentation represents my opinions, but is based on the references provided at the end of this presentation. Some topics I will be discussing include mechanism of action of the drug, side effects, drug interactions, correct administration of the medication, studies involved in the approval, how Tirzepatide compares to GLP-1 agonists, and further research that is planned. Tirzepatide was recently approved on May 13, 2022, for use as an adjunct to diet and exercise in people with type 2 diabetes. It was made available within the U.S. for pharmacies to receive and begin dispensing on June 7, 2022. The medication works as a dual GIP-GLP-1 agonist and is the first drug in its class. Tirzepatide works on both GIP and GLP-1 receptors to help in the management of postprandial blood glucose levels. GIP, or glucose-dependent insulinotropic polypeptide, and GLP-1, or glucagon-like peptide 1, are two incretin hormones that are secreted to stimulate insulin release and regulate postprandial blood glucose. These two hormones have been given the name twincretins due to their similar mechanisms. While GLP-1 agonists are already used for the treatment of type 2 diabetes, GIP is responsible for about 2/3 of the incretin effect in the release of insulin, which makes Tirzepatide's dual agonism mechanism so interesting. GLP-1 agonists currently work on GLP-1 receptors to cause an increase in postprandial insulin release, while also causing a decrease in glucagon secretion from alpha cells. Another notable mechanism of GLP-1 is the slowing of gastric emptying within the stomach, causing a decrease in the ability to break down carbohydrates, and also causes a decrease in appetite through binding to receptors in the hypothalamus. GIP works very similarly to GLP-1 by causing an increase in postprandial insulin release and also working in the brain to decrease appetite. One distinguishable difference of GIP compared to GLP-1 is that GIP increases the release of glucagon in patients who are in a euglycemic or hypoglycemic state. With the increase and decrease of glucagon release from the two hormones, they work synergistically to maintain healthy blood sugar levels. This is beneficial for decreasing the amount of hypoglycemic events in patients. Another notable mechanism of GIP is the increase of bone formation found in clinical trials, which may lead to further drug indications in the future. Some notable adverse effects related to the medication include diarrhea, nausea, abdominal pain, constipation, heartburn, and a decrease in appetite, as well as an increased heart rate and an increased risk of gallbladder and kidney disease. Tirzepatide also contains a black box warning for the risk of causing thyroid C-cell tumors. Contraindications with the use of Tirzepatide include a family history of medullary thyroid carcinoma, patients with multiple endocrine neoplasia syndrome type 2, and also hypersensitivity to Tirzepatide. Tirzepatide's effect of slowing gastric emptying can impact the absorption of any oral medications that are administered concomitantly with it. Patients should be aware of any changes in the effectiveness of their other medications while taking Tirzepatide. Tirzepatide can specifically decrease the effectiveness of hormonal contraceptives, and patients taking Tirzepatide should consider switching to non-oral forms of contraception or add a barrier method for 4 weeks after initiation of Tirzepatide, as well as for 4 weeks after each dose increase. The GLP-1 effects of Tirzepatide can enhance hypoglycemic effects of sulfonylureas and insulin, and caution should be taken when used together. Tirzepatide can also affect gallbladder function and can diminish the therapeutic effects of Syncolide. Tirzepatide comes in 6 strengths, beginning with a starter dose of 2.5 milligrams, which can be increased every 4 weeks by 2.5 milligrams as needed. There is no renal or hepatic dose adjustments. Tirzepatide is a once-weekly subcutaneous injection that can be administered into the abdomen, thigh, or upper arm. The correct way to administer the medication is by removing the base of the pen, placing the pen onto the skin, unlocking the safety lock, and injecting until you hear 2 clicks. The pen does not require priming before use. It should be injected on the same day each week, being sure to rotate injection sites. If a dose is missed, it can be administered for up to 4 days. This is an overview of the clinical trials that led to the approval of Tirzepatide. The studies included various comparator groups to the new medication for effectiveness in A1C reduction. Tirzepatide was found to be superior to each comparator group in lowering A1C, as well as in one of the secondary outcomes of improving weight loss. One of the pre-approval trials included comparing Tirzepatide to the already approved GLP-1 agonist semaglutide. In the randomized phase 3 trial, 3 doses of Tirzepatide were compared to the administration of 1 mg semaglutide. The outcome they were interested in was the change in A1C from baseline to 40 weeks, as well as the weight reduction seen within 40 weeks. Tirzepatide was found to be superior to semaglutide in reducing A1C, with the lowest dose of Tirzepatide obtaining a 2.01% reduction versus a 1.86% reduction in semaglutide. It was also superior in weight reduction, with the 5 mg yielding a 7.6 kg loss in weight, compared to 5.7 kg loss in semaglutide. All findings contain a clinically significant p-value. This study proved the synergistic effects that GLP-1 and GIP can have when working together. It is notable to state that while only 1 mg of semaglutide was used as a comparator in this study, semaglutide can be titrated up to a total dose of 2 mg. Using 2 mg of semaglutide in this study could have produced more comparable results. In semaglutide's drug approval studies, change in A1C was similar to the results found in SURPASS-2, but weight loss was greater in the original trial studies of semaglutide, warranting differing results between the 2 studies. Further studies are currently being done on each drug's efficacy in weight loss. Tirzepatide's full benefits are still being studied and include effectiveness versus insulin lispro, Tirzepatide's effects on the heart and obesity, as well as weight loss and comparison versus dulaglutide to first cardiac event. With the completion of more studies comes the possibility of guidelines being changed to include Tirzepatide for various indications. Thank you for watching, and I hope this presentation was beneficial in increasing knowledge on the use of Tirzepatide in type 2 diabetes.